Good day. Welcome. Welcome to Learning Thursdays. To those of you who are joining for the first time and to those of you who have joined us many times in the past. As a reminder or an introduction, Learning Thursdays were developed as a way to offer free learning opportunities to our field with the goal of improving the competencies that our field is tasked with. These competencies also include knowledge, skills, and attitudes to help you improve the lives of the individuals who come to your door, be it for treatment, prevention, or recovery services. While we talk about OASAS being for alcohol and substance use, we also talk about many of our patients also have gambling concerns. And because of that, we decided we're going to devote another Learning Thursdays talking about gambling. We're also talking about it in regard to older adults, and that May has been designated as Recognition of Older Adults Month in America. So we're going to take gambling, which may be a concern for older adults, and talk about that. Jamie Costello from the New York Council on Problem Gambling and Paul Noonan from OASAS will talk to you about it, and Jamie is going to tell us what the age definition is for older adults, which I'm quite curious about. So I'm not going to keep you any further. I'm going to welcome Paul, Jamie, thank him for being here, and I will talk to you all at the end of the presentation. Paul and Jamie, thank you.
Hi everybody, this is Paul Noonan. I'm the coordinator of Veterans and Older Adult Services for OASAS. I'm pleased to be here today to bring you another Learning Thursday presentation for your benefit and information. This being May, and May being Older Americans Month in the United States, something you may not have known, we wanted to share a topic with you devoted to issues and concerns facing older adults in this country. I'll let my colleague provide a definition of older adults in her presentation. And so today we're going to talk about the allure and risk of gambling among older adults. I'm going to be stopping talking in a couple of minutes, but I just wanted to tell you that we have an expert presenter on this topic, and I'm pleased to present Jamie Costello, who is a director of prevention and training for the New York Council on Problem Gambling, located right here in Albany. Jamie has worked with me several times before, and I consider her a professional of consummate ability and knowledge in this area. So without further delay, I'm going to happily turn the microphone and the presentation over to Jamie Costello.
Thanks, Paul. Hi, everybody. Thank you for taking the time out of your day to view this Learning Thursdays. I hope you gather a ton of information, or at least some tidbits that you can take and apply in your daily work, either with older adults in your job or in your personal lives. As Paul mentioned, I am with the New York Council on Problem Gambling. We are a small private nonprofit located in New York State. We cover the entire state, and with the two goals of increasing public awareness that gambling can become a problem for some people, and advocating for additional supports and services for those people who are negatively affected, either by their own or by somebody else's gambling. One thing I do want to point out is that the council maintains a neutral stance on gambling. So we are not pro-gambling, we are not against gambling. We are out to make a difference in the lives of the people who are negatively affected in some way by gambling. Our website is nyproblemgambling.org if you want some more information about our services. I will talk a little bit about what we do, just so that you have a general idea. In order to reach those two goals that I mentioned previously, we produce and disseminate information to a number of different audiences, typically upon request. So if you are in search of something specific to problem gambling, you can reach out to us. We conduct and publicly support ongoing research activities. A lot of the support from our board has to do with research activities and conducting and supporting those activities. We also sponsor workshops, trainings, activities, and conferences. This is a big one for us. We have a lot of requests for professional development specific to problem gambling and understanding problem gambling either in specific regions of the state or specific populations. Some presentations are specific to prevention, some treatment, some recovery. So if you're interested in more information about that, you can reach out to us too. We do have some learning available for inexpensive or free on our website. And the one thing I do want to put a plug in for is our 2018 annual conference on problem gambling. It'll be held at the Albany Marriott on Wolf Road, the same location it has been for a number of years. And this year it'll be on October 9th, 10th, and 11th. And the event again is 2.5 days long. The pre-conference is on October 9th. And there's only a small fee attached, and we anticipate being able to offer CEUs. So if you're more interested in that or want more information about that, you can go to our website. So for today's presentation, I want to just give everybody an overview of what we'll be covering with the presentation. We'll first talk about what the term older adults means. As Paul mentioned, he said he was going to let me define that, and I'm not sure I can even define that, but we're going to give it our best shot. So we'll talk about what the older adult term means, some of the life experiences and emotions that many of us face as we age. We'll also talk a little bit about what the term gambling is and how we define that, as well as how some communities and other populations might define the term, as well as specifically how older adults sometimes define the term. We'll talk about the risks that aging adults face when gambling that might be different from other populations. I'll also be sure to cover some of the warning signs that you can keep an eye out for when discussing problem gambling among older adults, but also among other populations. And we will talk about some next steps. So hopefully whatever information you gain from today's Learning Thursday, you can take and apply either in your job or your personal life. So we'll talk about some of the next steps that people may be able to take. As you'll see at the end of the presentation, my contact information is included in case you have any questions about something that's covered today or anything additional. So what exactly is an older adult? I didn't have the answer. So I asked some other folks what an older adult was. I asked my nephew what old meant, and he said old was 23. Something tells me that that's not what we're getting at today, and I'm also not okay with that response, so I did some more digging. Pew Research Center did a telephone survey to determine the differences between expectations and the reality of growing old in America. They surveyed almost 3,000 young, middle-aged, and older Americans, and they were asked to complete this sentence. A person is old when he or she blank. 13% of the participants agreed that a person is old when she or he has gray hair. 79% agreed that turning 85 makes you old. Based on the survey results, Pew determined that 68 is actually the average age that Americans determine someone becomes old. Personally, I see older adults as those age 65 and up, just based on the average age for retirement, Medicare eligibility, etc. For today's session, however, let's go with 65-ish. I don't like to put an exact number on it because aging and old means something different for every one of us. The key thing to remember is that everyone is different and everyone experiences the aging process in a very different way. The point is we're all in some way going through the process of aging, and sometime in our mid-60s, we all begin to experience some of the more tangible effects of aging. According to the American Psychological Association, the population of Americans aged 65 and older will increase from 46 million in 2017 to an estimated 98 million in 2060. 98 million, that's more than double the current count in just 43 years. So not only are we all aging in some way, but this proportion of the American population is growing at quite a rapid rate. One out of every four 65-year-olds alive today will live past the age of 90 years old. The average life expectancy of an adult living today is 84.3 years for men and 86.6 years for women. And just a fun fact for everybody so that we all make sure we're engaged in taking something away. The oldest American to date was Sarah Naus from Pennsylvania, and she lived to be 119 years and 97 days old. Paul says, wow. So we're not just talking about people who turn 65, and we're not just talking about those between the ages of 65 and 75. Today we're talking about all Americans nearing or over the age of 65. In fact, for the first time in history, the number of older adults, or those over the age of 65, will outnumber children under the age of 5. Why is this stage of life so different for people? Well, because life happens. The obvious and maybe more positive is that at some point, the majority of Americans are able to retire. 18% of Americans retire before 65, and about half of people are retired between 61 and 65. And by age 70, 81% of Americans are retired. Now, retirement might seem like a wonderful thing to many of us. We'll have time to travel, sit around, do whatever we want. But not only is retirement a form of stress, albeit eustress or positive stress, it can also bring about a number of negative, let's say side effects, for lack of a better term. For those of us who love our job, retirement might feel like a loss of purpose. We no longer wake up feeling needed by the patients we care for or the students we teach. We no longer, for those of us who might retire with not much savings, retirement might mean the inability to do the things that we dream of due to a limited income. And retirement isn't necessarily a positive life change for everyone. It comes with some pros and some cons. And then the older we get, the more our families grow and become a little more independent. As we age, we experience, again, those growing families, whether daughters or sons, nieces or nephews. The goal of parenting and being an adult role model is that your underlings will one day learn how to care for themselves. They will leave the nest and fly on their own. And if we've done our job well, they'll need us less and will be busy with their own responsibilities, jobs, families, etc. This is a double-edged sword. We celebrate the amazing human beings that they've become and may, at the same time, experience a sort of loss brought on by their increasing independence. Again, you've heard the term empty nest. Again, even good stress and typical life experiences can stir up both positive and negative emotions. On the not so positive side, we often experience some level of changing cognitive abilities as we age. Although it's true that some older adults face Alzheimer's and dementia, for many older adults, normal cognition changes are mild and don't affect daily living. Some more common minor changes experienced with age include taking a longer amount of time to learn new things, decreases in short-term memory, slower reaction time, and difficulty with problem solving. Again, although typical and considered minor on the scale of possibilities, these cognitive changes have the potential to create some level of frustration as we age. And at some point, the majority of us are going to experience a decline in our physical health as we age. This is one of those factors that you could argue begins earlier in the aging process. We find we aren't able to keep up with our kids, and then we aren't able to play our favorite sport, etc. The American Psychological Association reports that over 90% of older adults have at least one chronic condition, and 77% have 2 or more. And the term chronic conditions includes heart disease, cancer, stroke, diabetes. Visual and hearing abilities also tend to decline as we age. So just as we grieve for a loved one who's passed away, we may also experience grief and loss when we retire, when our children move away, when we're no longer able to enjoy the activities of our youth. And for some, this grief plays a role in the onset of gambling activities as well as the development of gambling addiction. So what is gambling? You'll see I don't have a definition on the slide. That's because gambling really, how you define gambling really determines on the lens that you're looking at gambling through. When I do workshops in person, I often ask people, how do you define gambling? And typically the mental health and the substance abuse professionals will define gambling as an addiction. You'll get some people who will actually give you an example of a form of addiction. When I say, what is gambling? They'll say the racetrack or the casino. And then you get some people who talk about how gambling is a waste of money or it's throwing your money away. And each of those people or each of those groups is looking at the term gambling through a very different lens. So it's important whenever we're talking about gambling or problem gambling or any other issue or concern for that matter to make sure that we're all actually talking about the same thing. So I'm going to show you what sort of formula we use at the New York Council to determine if something is gambling or not. The first element that must be present is risk. In order for something to be gambling, there has to be something at stake or something that you could lose. We also have value. That something that's at stake is typically something of value. It might be money, but in some cases it's not money. It could be a watch or your car, whatever is valuable to you. And what are you risking that something on? Well, you're risking it on a game of chance. For an activity to be considered gambling, there must be an element of chance involved. If you knew the outcome, it would either be considered cheating or something other than gambling. All forms of gambling have some level of inherent risk. Bingo and scratch-off tickets are 100% chance, while card games such as blackjack or poker may involve some level of skill, but the outcomes still contain an element of chance. If the deck is shuffled and you're not cheating, no one can 100% with 100% accuracy determine what card will be dealt next. So gambling is risking something of value on a game of chance, typically with some desired result or outcome, which can be a reward. These four elements together, risk, value, chance, or reward, make up gambling. By this definition of gambling, gambling includes betting at a casino, lottery, scratch-offs and pull tabs, bingo or whammo for money, playing cards for money, betting at the racetrack or off course, buying a square in a football pool or a basketball bracket, paying to develop a fantasy sports team, buying a raffle ticket at a fundraiser, and so on. So when talking about gambling as a risky behavior for seniors, it's important to ensure that everyone is taking risk, value, chance, and reward into consideration when defining gambling. And for understanding that all of those different forms of gambling are still that. They are still at their core a form of gambling. So some folks believe that a casino is gambling, when some folks believe that only the lottery is gambling. They really need to talk about what gambling is to make sure everybody's on the same page.
Jamie, I have a question.
Sure.
What about the, I'm going to call it probability, the element of probability.
Okay.
Because you're wagering against either a low probability or a high probability of
Sure.
something happening. Would that be part of the chance?
That is
element?
part of the chance.
Okay.
Just when I talk about, scratch-offs and lottery, there's still a certain probability, and some tickets have a higher probability that you'll win as opposed to other tickets, but there's still that level of chance. If the probability is 1 to 4, 3 times out of 4, you're still going to lose. You're going to win 1 time, or 1 to 3. So that level of probability is what determines. And if we think about sports and things like that, where some people look at the point spread or the record, there's always that element of chance. I go back to the one famous Super Bowl year where the New York Giants were not supposed to beat the Patriots, and yet somehow they did. There's still an element of chance, even if you're playing pool against somebody that you know is not very good and you are very good. There's still the possibility that you could lose that time. So with gambling, there's always some level of chance.
Actually, that was 2 years they did that, if you remember.
Twice the Giants weren't
For you
supposed to
Giant
win, and they
fans out
did. Good question, Paul. Thank you. So through the lens of seniors, there was one research study that was done, and the seniors that were asked, they were age 65 and up, and they were asked what gambling was, or what forms of games were considered gambling. And they considered off-course betting, the casino, and bingo as gambling, but they did not consider the lottery, scratch-offs, and raffles as gambling. So the researchers took a step back and said, why do we think that some forms of gambling are considered gambling and some forms aren't? And it turns out that a lot of times when people view that the game has an end purpose, such as raising money, if we think about raffle tickets at a basketball game, they're raising money for the sports club, the booster club, whatever that might be. When we think about it in that terms, the seniors that were surveyed didn't view those forms of gambling that were a means to an end as gambling. So again, when working with clients or when working with the community or you're talking to your loved ones, it's important to think about what they consider gambling and not. Maybe gambling isn't the term you want to use. Maybe you want to talk about their trips to the racetrack. Maybe you want to talk about their experience at bingo instead of using the term gambling. So it's important to think about that lens and who's using that lens and how they're using the lens to define gambling. So a lot of seniors are gambling. So what is the percentage? The percentage of seniors who have recently gambled in 1974 was about 20%. And again, this was self-report, so you can question the accuracy if you'd like. But self-reported in 1974, about 20 seniors had gambled recently. In 1998, that percentage had increased to 50%. And now 2018, we are 30 years after No, we are 20 years after 1998, and we're facing major changes in the gambling landscape, not just in New York, but across the country, including new forms of gambling and more brick and mortar gaming facilities. Additionally, the gambling activities and trips are some of the most common activities offered by some retirement centers and senior centers. It's likely that if we conducted this exact survey again 20 years later, we would see another increase just by the nature of the changing landscape that we're seeing. And even if we go back to that 50% 20 years ago and say that it hasn't increased, based on the fact that America is experiencing the largest proportion of adults aged 65 and over than ever before, there are larger numbers of adults gambling at higher rates than ever before. So are all adults or all aging adults gambling? Are they all experiencing problems? Absolutely not. A lot of folks gamble and never develop a gambling problem, just like some people drink alcohol and never develop an alcohol problem. There are some adults and some seniors who have never gambled. You'll notice that no gambling category is not totally in the green. It's not completely safe, because even if you're not gambling, you can have some predispositions for a gambling problem. Say a loved one in your family had a gambling problem, or you have another addiction problem or a co-occurring mental health condition. All of those things can put you at risk for not just a gambling addiction, but other gambling problems as well, or other addictions as well, excuse me. And then we have social gambling. Many people who gamble are what we might call social gamblers. They're people who gamble purely for entertainment. They're able to set limits on their time and their money spent while they're gambling, and they stick to those limits. They are realistic about their expectations for gambling. They go in with expecting to lose. Just like if they go to a movie theater, they don't expect to leave with money. They expect to leave with the gut ache from the popcorn and the story about the movie. Gambling should be treated in the same way. Gambling was established to be a form of entertainment. So social gambling, when we're social gambling, we go in, we expect to lose, and we enjoy ourselves, and it's a nice little surprise if we win. But that's what makes us social gamblers. We enjoy gambling for what it's meant to be, which is entertainment only.
Can I ask another question?
Absolutely, Paul.
This may happen again and again. It just occurred to me. What about an auction?
Oh,
I mean, that's part of fundraising in a lot of, in a lot of instances. Would that be considered gambling?
So we get that question about auctions a lot. And so I'm gonna go back. Keep up with me, everybody. Here we go. Okay, so if we go back to an auction, we have risk, value, chance, and reward. So in an auction, with the reward, you would win something, right? If you won, you would get the object you were bidding on. There's an element of chance because you don't know if you're going to get it or not. However, if you think of that risking something of value, we don't really have that, because when you have an auction, you bid, but you don't put your money in and lose your money and never see it again. So in an auction, you're still, so some of the drive may be there, right? That same feeling, that same excitement of sitting on the edge, but you're not actually risking something of value, because you put a bid in, but you're not risking, if I bid $20, I'm not gonna lose my $20 if I lose the item, right? Does that make sense? Does that help? Okay, so auctions, perfect question.
Thank you.
You're welcome. And then over here we have problem gambling, which is a little more risky. You'll see it's more in the red. So in social gambling, you'll see this is really on a spectrum. So we have no gambling, and then you begin gambling. It can be social if you're using it for entertainment. And for some people, that gambling goes into problem gambling. So what is problem gambling? I received the question a lot of, what is problem gambling? Is that like when I run out of money? Yes, problem gambling can be when you run out of money. But at its simplest level, problem gambling is anytime your gambling causes problems in your life. Some people who struggle with their gambling are spending increasing amounts of time and money. They're using money that's needed for something else, and they're chasing their losses. That type of gambling behavior can cause money problems. It can also cause mental health struggles, relationship, work, school difficulties, and things like that. And remember, just as we all define gambling differently, we also likely define problem differently. So it's important to remember that gambling problems are very individual and look very different for a lot of people, for everyone, in fact. And then you'll see gambling disorder way over on the right in the pure red. Gambling disorder is just that. It's a disorder. It's a mental health disorder. In the latest edition of the Diagnostic Statistical Manual of Mental Health Disorders, or the DSM-5, as some of you know it, what was previously categorized as compulsive gambling has actually been reclassified as gambling disorder in the addiction category of the DSM-5. And the major difference between problem gambling and gambling disorder is that a diagnosis by a mental health professional has been made. And in many cases, gambling disorder is more severe than problem gambling, but problem gambling is really the umbrella term that also includes gambling disorder. So now that we are all looking at this through the same lens, we have the same base information about older adults, about problem gambling. Let's take a look at the relationship between the two things. So why do many older adults gamble? Paul, I'm going to put you on the spot for a minute. Why do you think many older adults gamble?
Well, from what I've observed, I think they do it mostly because it's a social activity, and many older adults, as we've learned earlier, are retired, and it's recreational for them.
Right, so they're using gambling as exactly what it's
Yes.
intended to be. It's intended to be entertainment, some sort of form of recreation. You're exactly
But
right.
it also brings them into contact with their peers, which I think is important to them as well.
It brings
So,
that social element
Yes.
also. Absolutely, you mentioned the buses bringing the people to the casino. It's an event. It's a day trip, sort of, for a lot of people, older adults as well as anybody else. So many older adults gamble because it's exciting. They gamble for the same reason that kids gamble, that middle-aged adults gamble, youth gamble. It's exciting. Gambling is intended to be a form of entertainment and to provide excitement and recreation for those who participate. And that's why most of us gamble. It's fun. But what happens when it's not fun anymore? What happens when we get to those problem gamblers, when it's not exciting, it's not recreational, we're actually experiencing some problems due to our gambling? One study found that 1 in 11 adults over the age of 65 bet more money than they could afford to lose in the previous year. That's almost 10% of people. It's about 9.999% of people. So think back to how we define problem gambling. If you're spending more money than you can afford to lose, is it a problem? Maybe. So many seniors gamble for entertainment, and a proportion of them are struggling with problems associated with their gambling activity. So I have to wonder, why are some people struggling and other people are not struggling? Paul, do you have any guesses on the risk factors of why some people struggle and some people don't struggle with their gambling?
That's a really good question.
I challenge anybody who's tuning in today to pause if you have to and think about that for a minute. Why do we think some people are struggling and some people are not struggling with problem gambling?
Well, I would think it's really no different from the seeds of any other addiction. I mean, I would wonder if there's some sort of genetic predisposition first. Mm-hmm. And I'm going to leave it at that.
That's okay. Most people say, when I ask them, I say, why are some people developing a problem and other people aren't? And I often get a quiet room, and then I say, put your addiction hat on. Put your addiction background or your background in recovery or your background in treatment or prevention, put your addiction hat on and think for a minute. And a lot of the risk factors are very closely aligned with problem gambling and other substance use disorders. I did find a few studies that were specific to senior problem gambling. One was done by Tira Chaimangal, Jackson, and Tomney in 2010. And their aim was to examine exactly that, the risk and the protective factors that combine to form different pathways to problem gambling for older adults. They categorized the risk factors they found into 3 categories: individual vulnerability factors, social environmental factors, and behavioral regulation factors. So let's take a look at each of these categories of risk factors a little bit more closely. And while we're going through each factor, think back to those individuals that you may support through your work or the people that you're in contact in your personal life who are of that aging population, again, however you might define aging or older adults, and think about how some of these may or may not apply to them. For the individual vulnerability factors, we have a distressing situation. So something happened in your life. And again, these from this study were specific for older adults. So a distressing situation, you have something specific that's happened in your life that's put you under an increased amount of stress, typically negative stress in this case. You have some sense of urgency or some sense of apathy. You don't feel one way or another. It's you have a little bit less emotion, so maybe you need that feed to feel excited. There are service barriers, and we have service barriers in every field possible. I would say mental health, addiction, education. There are a lot of barriers to services within the community, and that can be one vulnerability for late life problem gambling, or what we consider developing a gambling problem later in age. We have absence or lack of support. So seniors who may or may not be supported by their family or may not have that social support network, who don't have time. Again, as we age, we have growing families and they're taking care of themselves and becoming more independent. So that lack of support can put seniors in a vulnerable place for developing a gambling problem. And then we have, if any senior has unhelpful coping or problem-solving mechanisms and expectations. So if they're not able to find healthy ways to cope with their stressful situations. Yesterday I was trying to figure out what I meant by healthy coping mechanism. And to me, a healthy coping mechanism is a coping mechanism that lets you detach a little bit, but also doesn't create more stress in your life. And so if we think about some healthy coping mechanisms, I consider healthy as in going to the movies with your friends, or writing in a journal, or reading a book, or taking a walk, or talking to your dog, or taking a bath. And then we have those unhealthy coping mechanisms, which might actually create more stress, such as gambling, or drinking, or smoking, or eating. So those can, depending on what the coping mechanisms are in a senior's life, if he or she has not over the years really developed a healthy way to cope with stress or difficult situations, that can definitely put them more at risk.
Okay, I'm going to put you on the spot.
Okay.
I see a distinction here, because in my mind, the person who smokes or drinks or injects or swallows a pill is almost always guaranteed a high from that. The person who gambles, to me, the high is winning, isn't it?
Actually, the high is not always winning.
Aha.
For some, the high is winning, and initially it's that first big win, right? Our director Jim Maney always says that first big win is what really hooks you, or hooks somebody who's gambling, and then you do get a high. You get a spike in the dopamine, the adrenaline, all of that.
I could see that, but an individual might have to risk, perform an act of gambling or wagering, whatever you want to call it, numerous times before they win, and therefore get the high. I see that as a
right. You're not always
Right.
guaranteed a high when you gamble, because the high typically comes with winning. But a high for somebody who has maybe decreased regulation or less emotion just in general, a high doesn't necessarily mean a good feeling or that spike in dopamine or adrenaline. A high means some sort of feeling at all.
Okay. Well, that's good to know.
And that some research has actually shown that edge of the seat, or that just not knowing, waiting for the outcome, can sometimes be a higher high for gambling than other ones. I compare it to roller coasters. Do you like roller coasters? Paul says yes, he likes roller coasters. So think about when you're waiting in line for a roller coaster. You're waiting in line and you get excited, and the closer you get to being on the roller coaster, the more excited you get. So you're next in line. So how does that feeling next in line is like that rush? I have goosebumps right now talking about it. So I have goosebumps because I'm excited. We're going to get the first seat. It's going to be so exciting. Then you get on the roller coaster. You spend your 35 seconds and you get off and you say, that was it. It's almost more exciting and thrilling being on the edge. It's created a different feeling in you than being on that roller coaster. They're two different feelings. It's excitement, it's thrill, but they're
That's
two
amazing.
different.
In my mind, that's what makes this issue a very dangerous issue.
Absolutely, and it just makes people feel. And so if people are at the point where they just don't feel anymore, you may have some seniors who have detached from their lives a little bit. Maybe one of those risk factors I mentioned was apathy, that feeling where I just don't have that emotion as much anymore. And that on the edge of the seat, or the chance that I will lose this much money, that risk can actually be more of a rush or a feeling than that high of winning that much money. Does that make sense? Absolutely. So when we gamble, or when people gamble, the high doesn't always come from that winning. It can also come from something else. So those are some of the individual vulnerability factors. Let's talk about the social and environmental factors, because gambling is not just an individual's problem. It's not just an individual who's at risk. It's not just a money thing. It has to do with the environment and the society they live in. So some of the factors that can put seniors specifically at risk for developing a gambling addiction are an unsupportive environment. So really we go back to that. I don't have a support network, and the environment that I'm in is just not a supportive or healthy environment. Seniors who are novelty seeking, so they like those things, new things all the time. They're very easily bored. They like suspense, or have just in general an impulsive temperament, can put them a little bit more at risk for having a gambling problem as well. The researchers also found that the illusion of control and a biased memory, or some superstitious, which might seem like an individual factor, but if you think about society and how we maybe talk about gambling or portray it, the illusion of control and the superstitious beliefs can play a huge role in that. And your peers can structure your superstitious beliefs too. For example, the peers that say you can't wear your red shirt to the football game because our team lost last time you wore the red shirt. Having that belief that my red shirt has the power over everything is maybe an irrational thought, but it's brought about by the environment that I'm in. If gambling is a significant part of your culture or your ethnic identity, that can put you at an increased risk for having a gambling problem, because gambling is just seen as normal and it's a natural thing that everybody does. It goes back to that family risk factor.
Well, that's fascinating. Some cultures or ethnic groups are more closely identified with gambling than others.
There are some cultures who are much more superstitious than other cultures, and that superstition plays a role. And I think back to just families. I think the stories I hear of my grandmother, she'll stop and turn around if a black cat crosses, never walk underneath a ladder. Those sorts of feelings. If you have that superstition that's built into your culture and it feels like it's real, whether your red shirt controls things or not, you will believe it if that's what you're taught and you've learned to believe over the years. And that happens in some cultures. For example, the Asian culture, I've heard from a number of folks and researchers that superstition and luck and things like that, and the beliefs that are ingrained in the culture may not be seen as gambling, but when we think about it, those superstitions can really play a role in how somebody reacts to a gambling activity or situation. So absolutely. And then we have the big win. That's something that can definitely hook somebody into having a gambling problem. If they get that big win, especially early on, can really hook them in. Again, needing to prove to others and peers around them, needing to prove something that can put them at risk. Having some sort of reliance on gambling, and then enticing gambling promotions, incentives, or misleading advertisements, which if you think about the aging population, they may get a lot of coupons, a lot of enticements, a lot of advertisements about gambling because they go to a gaming facility, and it's just what happens. Everybody does. But having those in your life on a regular basis can put you more at risk. And then specifically with the aging population, we have some behavioral regulation factors that the study found. Having just in general a disinhibition and being okay with pushing the line or towing the line, as some people say. Having impaired decision making and judgments and having an increased risk-taking propensity. Again, that really comes with, that's one of those cognitive changes that happens the older we get. The more our brain changes and figures out how to make decisions differently. When I talk about adolescence, I talk about how the brain develops from the back to the front, and the last part to develop is the prefrontal cortex, or that part right in the front where that makes really good decisions. As we age, the part that goes away the first or lacks a little bit the first is that prefrontal cortex. And then proximity to gambling facilities, the closer you are, can make you more at risk. Some studies have shown that 50 miles within a gaming facility, you increase risk. And then having multiple addictions or comorbidities can also put people at risk for developing a gambling addiction. Now, those were some of the factors that were specific to seniors. So how does it happen? How does somebody become addicted? Those are some of the things that get us to start gambling, but how does that progress into a gambling addiction? I ran across a couple research studies, and there was one that really examined the pathways and how a number of seniors, it looked at individual stories, so it worked with the grounded theory, which means that it worked on basic stories of people and how they became addicted and how they started gambling, what that progression was to gambling, and why they stayed, or why that activity perpetuated in their lives. And so again, late life, you'll see this, late life, what we mean is that the individual developed or experienced that gambling problem later in life, as opposed to having the gambling problem when they were younger and carrying it into late life. So in summarizing the research, the group of researchers identified 3 pathways to late life problem gambling in seniors. A grief pathway, and that was associated with some unresolved losses, maybe some coping issues. They examined, or they found a habit pathway, which was associated with just a general habituation to gambling, that routine of over and over again. And a dormant pathway, which was really marked by the pre-existing impulsivity or comorbidity that they had pre-existing the gambling. And for each pathway, researchers, again, examined the individual's entry, progression, and perpetuation to gambling. And because this study found that the grief pathway was the most common and detrimental pathway associated with late life problem gambling, we're going to take a closer look at that pathway. So again, you'll see here we have the entry to gambling, the progression of the behavior, and then that perpetuation. For those who have vulnerabilities associated with the grief pathway, which is a substantial loss, in most cases was the entry to gambling. So when we talk about that substantial loss, it can be the experience of an illness to yourself or a loved one, a stressful or anxious, anxiety-creating event, or anxiety due to conflict, an abusive relationship, or otherwise just stressful event or situation. And that caused an increase in that general negative emotion, including despair, loneliness, depression. And for most of the people, the participants in the study, the stressful events and negative emotions occurred before or around the same time as a typical gambling behavior, in turn causing that individual to seek out the gambling activities, venues, or incentives. And then we talk about the progression. Those who proceeded to have a late life gambling problem, they reported using gambling to manage the overwhelm caused by their negative emotions or to have a break from their emotions. So they were really looking to get away or to find a way to cope with the situation and emotion they were facing. When they found that coping mechanism or gambling got them away and made them feel better momentarily, they perpetuated that, and then they continued to gamble to forget or to augment that personal space. You talked about loneliness or despair or isolation. They found that gambling really filled that hole in their lives. And overall, the authors cited that the unresolved loss or the mismanagement of their losses was one of the highest or the strongest predictor of a late life problem gambling. So we're really talking about people who are experiencing loss. And I often ask folks, what is the number one emotion that we deal with or have to experience the older we get? And that emotion or that feeling is grief, right? When we're 5, I apologize for anybody who's heard this story from me over and over again, but when we're 5, our goldfish dies. And we have the funeral in the bathroom, and we're playing the trumpet, and the whole family is squished in there. And I'm thankful I don't have to clean the tank anymore. And my 5-year-old's crying on the floor because that's his first experience with grief. And then at 10, the dog passes away. And then at 15 or 20, the great-grandparents, and then the grandparents, and then the parents, and then the spouses or partners or siblings. The older we get, the more grief we have to deal with. And if we don't find a healthy way to cope with that, we're likely to look to something else to find to cope with that. And if we don't find healthy coping mechanisms, we're going to turn to unhealthy coping mechanisms. And then, go ahead, Paul.
I just want, I sometimes speak about older adults and the opioid problem, and I talk a lot about the grief issue. And one thing I like to highlight is I believe many folks are grieving the loss of familiarity. The world that they once knew and felt so comfortable and safe in has changed so much for them that they don't understand these changes. And it's something I've being an older person myself, it's something I'm beginning to understand. And I can remember listening to my own parents and their peers when I was young, and they didn't understand the British invasion and the hippie thing and everything. And I see that as a grief issue. You no longer understand what's going on around you, and you have trouble accepting it.
Oh, absolutely. And grief isn't just when somebody dies. You grieve, as I
Yes.
mentioned really early on, 40 minutes ago, I mentioned that retirement and your family's growing independence, or your kids or grandkids are growing independence, that can be a really positive thing, but that still leaves you with some sort of loss.
Right.
So the positive, the negative, when you were talking about the changing world and not understanding it, when I took this position, I got my first iPhone, and I didn't know how to use it. And I was 30 years old when I took this position, and I had no idea how to use it. And I felt some sort of disconnect from everybody else around me because I didn't know what I was doing. And so I don't want to say I was grieving my flip phone, but I was grieving the loss of my flip phone and the fact that I had this detachment from the world, and I didn't have any idea how it worked. I was embarrassed to say that I didn't know how it worked, and I didn't know how it fit into my life. So I can completely see that I don't want to say detachment, that's not the word I'm looking for, but that, things aren't the way that they used to be, and I don't know how this fits into what's going on now, and just not knowing that or understanding it. That was really a simplified explanation.
I think they
but
they almost feel like strangers,
Yeah.
in a strange world. And yeah, the whole technology thing. I remember my father-in-law calling me when VHS players and VHS tapes were the big thing, and he had one, but he had no idea how to work it, and he just out of frustration, he'd say, I'm too old to learn this, and he would always call me and say, will you record this or record that for me? But I think it really bothered him.
Yeah, it's a lack of almost connection
Right.
to what's happening in the world as we see it. So that loss doesn't have to be a death. It doesn't have to be an illness. It can be just the changing world and not feeling as connected to that. And again, that's the number one predictor for somebody who might develop a late life gambling problem, is that mismanagement or just the non-management or the avoidance of that loss, or trying to cope and fill that need. So again, most people gamble because it's really exciting. However, some people, and specifically some older adults, they gamble to manage their despair or their boredom, or to experience some sort of harmony in their life, or they gamble because they have feelings of isolation or loneliness. Some gamble to avoid the anxiety or depression caused by a life stressor or something out of their control, specifically a cone over your head, if you're looking at this now, or to deal with some sort of condition, such a larger mental health condition, such as depression. So gambling for excitement is recreation. It's fun. It brings about some sort of camaraderie with your friends, your family. But gambling for any of these reasons, really all it's doing is putting that Band-Aid over something. If you have unresolved losses, again, or mismanagement of your stresses, that is the most significant predictor of the late life problem, gambling. And gambling becomes that Band-Aid. We cover the emotion, or we cover the situation faced by the older adults. So I looked up the definition of bandage because I was using the word bandage or Band-Aid for this. The word bandage, actually defined at its simplest core, is covering for a wound. If you're using gambling as a covering for your wound or your loss or your depression, you are more likely to develop a gambling problem. The gambling, using it to avoid or cope those stressors or those negative emotions, it's not going to fix the situation. It's just going to cover it up for a little while and lead to more problem gambling. So whenever we're using gambling as a Band-Aid for something, you're likely to develop a problem with that. So how can you tell that somebody might be struggling with a gambling problem? Now, I want to go over 9 basic criteria that are listed in the DSM-5 for gambling disorder, not so that you can diagnose. I'm not endorsing anybody diagnosing a problem unless you're a trained and licensed mental health professional, but because these are many of the behaviors or patterns that you might see in someone with a gambling problem, specifically the older adults that you work with or those in your life. I want to just run through the criteria really quickly. A tolerance. A tolerance to gambling may indicate that you have some sort of problem. And what do I mean by tolerance? Well, again, put your addiction hat on. You need more and more time or to spend more and more money to feel the same rush that you did before, or to risk the same amount of money. It may, as you mentioned, Paul, it might not be about the money that you win. It can be the money that you're risking. So you used to feel competitive or risky when you wagered $5, and now you have to spend $50 or risk $50 to feel that same level of rush. And with gambling, and specifically gambling addiction, we also see withdrawal within some people. So if I take gambling away, so if every Friday I go with my friends on a bus trip to a gaming facility, and then one Friday I can't go, some of my friends are going to be okay with that, because gambling was just meant to be recreation, and they're going to go to the movies instead or do something else. But some folks may internalize that and really go through a sort of withdrawal because they are not able to access that gambling. Now, they may not be on the floor compulsing, but they can still face withdrawal. A lot of times people say, well, you're not putting a substance in your system, you're not going to go through withdrawal. But think about the way you drive to work. You drive the same way to work every day, and one day you face construction and you have to go around. The whole rest of your day is sort of thrown off. I've asked that question on what would you do, and I've had some people say, I would go home and I wouldn't come back. I would start my day over again. So again, all I did was take away your route to work and you went through withdrawal. Gambling and problem gambling can do the same thing. So if you're working with older adults who are gambling and one time they can't gamble just as they did before, and they're experiencing some level of anxiety or worry or edginess or change in their personality because they can't access that gambling, that can be a sign of withdrawal. And then you have preoccupation. So preoccupation is simple. It's if you're not gambling, you're thinking about it or you're talking about it. That gambling starts to become a part of your life. It's not just one thing you do for recreation, it's the thing you do for recreation. And then escape. Again, this goes back to that grief and loss. If somebody is gambling to escape, whether it's facing their own life or their life history or their impending death or the changes at work or the retirement or the growing family, if you're gambling to escape something, it's a sign that there may be a problem or you're more likely to develop a problem. Folks who chase losses, so what I mean by chasing your losses is that you lose and you go back to try to win it back. Any sanctioned form of gambling is meant to make money for the house, for lack of a better term. And so the more you play, the more you lose. So chasing your losses really just becomes a perpetual cycle, and it's not healthy. You're no longer using gambling for entertainment, which is what it was intended to be. Lying is another warning sign that somebody has a gambling problem. If you're lying about something, it's a sign you have a problem. Just in general, if you're lying about what time you come to work, if you have to cover something up or you have to lie about something, it's a sign you may have a problem. And if you're hiding your gambling from your loved ones, your friends, your family, that's a sign there may be a bigger issue going on, specifically with the gambling. If you're jeopardizing relationships or opportunities, you may want to take a look, or if somebody you know, a loved one or a client, is jeopardizing relationships or opportunities for their gambling, that sort of signifies that gambling has become a higher priority in life than the job or the traveling on for retirement, etc. Bailout. And I don't mean for jail, however, I guess it could be for jail. But what I mean is you have to rob Peter to pay Paul because you spent all of your money gambling. So I spent my rent money gambling, so I have to borrow money from my cable bill or my sister to pay my rent because my money went to gambling. Or I just need money just this one time, it's all I need and I'll win it all back, that sort of bailout feel. And then just an overall loss of control. If an older adult or a senior that you've worked with has said, I want to stop gambling, but I don't know how, or I've tried and I can't stop, it's a sign that there may be just a deeper issue there. It's no longer a habit, it's no longer a problem. It's a much bigger problem, I should say. So I've tried to stop, but I just can't is one of the big warning signs, the major warning signs of a gambling problem. And then just some older adult specific warning signs. Gambling alone for anybody can signify a problem, but for an aging adult, they may be gambling alone because they're lonely, which makes them feel like they're connected to a social network. And if the gambling or the bingo hall or the corner store with the scratch-offs is the only form of social interaction they have, that's going to become a problem because, again, they're using gambling to fill some sort of void, and it's just a Band-Aid. It's not actually going to fill a void. What they find sometimes is that people who use gambling to fill those voids or manage those stressors actually end up causing themselves more despair down the road when they look back on that. If there's been a major change in financial status, the retirement got cashed out and is gone, or the life insurance policy got cashed out and is gone, that may have been a choice that person made, but if they have some sort of major change in financial status, they had to sell their business, unexpectedly, things like that may be a sign that there might be a problem. A sudden change in medication regimen. So if you know an aging adult or a senior who is going without food or going without medication or suddenly is no longer taking any of their medications, it may be a financial issue, and it's important to look into the deeper cause of that financial issue. It may just be money, that they're mismanaging their money. It might also be because that money is going toward gambling. An overall change in behavior or personality can be a warning sign of gambling problems among older adults, as well as anybody else. And then a lack of other activities. If you remember, a few of the research studies that I shared, as well as some of the other information, really goes back to that support network. It's so important for seniors and aging adults to have a support network. It's important for all of us to have a support network as well. If you think back to Maslow's hierarchy of needs, belonging is pretty close to one of the core needs of us as human beings after food, shelter, water, safety. Belonging, we all need to belong. So seniors, it's very important for them to belong as well and to feel that they're empowered and they're independent and have some sort of support around them. So what do we do with all of this information? Research has shown that although individual directed treatment and prevention have the potential to change the individual behavior, we really have to address every level of the system or every level of the community that seniors or an individual is experiencing in order to improve those treatment outcomes, to prevent relapse down the road, and to decrease those risk factors associated with all problem gambling, including late life problem gambling. Let's take a look at each of these. Well, we have you, whoever's sitting in the chair listening to us today. What can you do? First is knowledge and education. You're watching the video. That's a fantastic start to get a general idea of aging adults and why it's important to think about problem gambling with them. It's important to stay up to date on what's happening, specific with the older adult population and research in general, but also problem gambling specific. It's important to listen to the individuals or families you work with to think about what their lens is, their attitudes and behaviors about gambling, so that you're in the loop and know what's going on. And to be aware of those resources for education, as well as resources and referrals for the people you work with. Of utmost importance, which should be bold and giant on this screen, is the approach and language toward gambling and those who participate in the activity that you take. So we all have this lens that we look at gambling through, and that lens really affects the approach that we take and when we speak about gambling, and it also, our language really portrays that feeling or that feeling or emotion or attitude that we have toward gambling. Stigma is one of the most formidable barriers to seeking treatment for problem gambling out there, and your language as well as your approach to gambling makes a huge difference in that. So think about the screening tools or questions that you use to identify problem gambling or other addictions. Is the language you use clear? Is it stigmatizing in any way? In treatment, you want to maintain an encouraging and strengths-focused perspective. And that perspective and that approach and language is especially important to older adults who are working to maintain their sense of independence, their sense of autonomy. You want to really support them and empower them as they approach things. Now I mentioned briefly about screening. How do we find problem gambling? Well, problem gambling is very hard to find. We refer to it as the hidden addiction because there's no screening test. Well, there's screening tests, but they're all self-report. There's no blood test, there's no urine test, there's no breathalyzer for problem gambling. It's really like finding the needle in the haystack sometimes, and you can't just go in looking for the needle. You have to look around for other things and sort through with some sort of intention and to find that. Researchers found that of those individuals with a lifetime history of pathological gambling, 49% received treatment for a mental health or substance use disorder, but none received treatment for any gambling problems. Why? It's likely that their treatment provider or their mental health provider didn't screen or didn't find the gambling problem. There are a lot of gambling screens out there, but the difference between research and clinical practice, the differences are important because in research it's a structured environment, it's very prescriptive, it's held to a high level of fidelity. When we're talking about clinical practice, it's very different, and every individual is different. So we have to think, how do we approach that? How do we find problem gambling among these older adults that we that we work with without stigmatizing them or stigmatizing a behavior that, let's face it, a lot of them participate in gambling as a form of entertainment and don't have a problem. So how do we talk to them about problem gambling without stigmatizing or putting off, making them feel uncomfortable about their recreation? First, it's important to think small. You want to not go in with diagnosing questions or talk about gambling addiction, gambling disorder. It's important to really steer clear of those terms, because that can stigmatize or make it feel like it's this big bad thing that we can't talk about. Just bringing it up in conversation and taking caution about how you're talking about problem gambling. I think of a news story I just heard, and I heard somebody say, those addicts, like they were the other people. Well, these people who are struggling with addiction and problem gambling, these aging adults who are struggling with a gambling problem, they're just like you and me. They're just like our grandparents, just like our parents. And just like, again, like us, they're all around us. So it's not a they and an us situation. It's really about talking about gambling and how it's risky in general. Bring that up in conversation.
Right. And many people, the stigma actually, I believe, keeps people from seeking treatment because they don't want to be identified.
Mm-hmm. I don't want to be classified.
Right.
I don't want to have a label put on me. And so when we start talking about problem gambling and we talk about a label that we're putting on people, you're automatically going to stigmatize those people and decrease the chances of them seeking treatment. Absolutely. And gambling is really so accepted in our culture and in our communities that it's not seen as a problem. So the first person who says I have a problem, everybody else is kind of left wondering why, what's going on? I didn't know gambling can become a problem. How does that happen? So something really important to think about is how can I incorporate gambling or problem gambling into all of the assessments and conversations that I have with people without stigmatizing them. By talking about gambling and recreation and how some people develop a gambling problem, you bring a sense of familiarity to those that you're working with. And let's be honest, if we as a field aren't talking about gambling and the risks and how it can be a problem, we can't for 1 minute expect our patients or our families to talk about that either. So changing the field is really important, and changing the field and mindset of people who work with seniors on a regular basis, whether it's at nursing homes or retirement centers or assisted living facilities, or even just at community senior centers. It's important to think about how we as professionals view problem gambling and how we're relaying that to the populations that we work with so that they can also talk about it. And when you're talking about assessments and conversations, and you're bringing things up, and I say think small and talk about recreation, you want to do that really non-confrontationally. Ask them what they like to do for fun, or ask, how's retirement? Who do you spend your time with? Where are you going on their trip? Those sorts of conversations really get at, is this person even gambling? And if they are gambling, you can explore that a little bit. And as many of us know, when you start to talk to somebody and you build that rapport with them and they're comfortable talking with you, they share a lot of things. And so it's important to take those things and just keep in mind that that gambling can become a problem for those folks. So the clients and families we work with, how do we help them? Knowledge and education at the top. We want to educate people about how gambling can become a problem. We want to take notice of what they're doing for fun. We want to let them know about the risks and rewards that can be associated with that. We talk a lot about decision making and informed decision making. It's important to know the pros and the cons of every activity before we participate. Become involved in their lives, whether you're a family member or somebody who works with aging adults. Become involved enough that you're comfortable talking to them, that they're comfortable talking to you, to help prevent that gambling problem in the first place or other addiction problem by creating that network of support. And then there are some possible immediate financial actions that families can take to protect themselves. And I put that up there not so that I can run through what all the financial actions are. That's a whole separate Learning Thursday if we want. But those immediate financial actions, I think it's important for families to know that you have to protect yourself as well as the person in your family who has a gambling problem, whether an aging adult or a child or a coworker or a friend or a neighbor. If we can't take care of ourselves, we can't take care of anybody else. You have to fill your bucket up first, put your oxygen mask on first, right, before you help other people. So know that clients and families also need to take care of themselves. And then as a final note, when working with older adults who are at risk for a gambling problem, specifically with this population, it's important to remember that education alone is not effective at all. We need to understand that broader context of life that the seniors are living in. We need to support them to identify and address those risk factors and the factors that perpetuate their gambling. And the goal is to promote older adults with well-being overall, which means that they're meaningfully engaged in their community and activities, they're appreciated, they're respected and empowered. And if we can do that and take a look at gambling problems or gambling activities with that sense that we want to make sure that the senior or anybody for that matter has an overall sense of well-being, that'll make us much more effective in preventing gambling problems as well as other addiction problems down the road. And then as an organization, so for those of you watching who either own your own private practice or work in a small agency or a larger state agency for that matter, it's important to examine the culture that surrounds gambling within our own agencies or communities or groups. Is problem gambling included in your mission? Has your staff been trained to prevent, identify, or treat problem gambling among older adults? Are there activities at your organization that might put those struggling with a gambling problem at an increased risk for relapse or for continuing to gamble despite the consequences or lack of control? And again, before we can talk to older adults in our lives about problem gambling, we have to take a really close look at the lens that we are using to view gambling from our individual perspective as well as from our organizational perspective. So let's recap what we've covered today. Older adults can be identified as anyone over the age of 65-ish. This segment of the population is growing more rapidly than ever before, and at some point in our lives, we will all be older adults. And aging is a very individual process, but it's one that comes with both positive and negative stressors that we manage as we age. And when we manage those stressors, we can also manage positive and negative stressors in positive or healthy or negative, not so healthy ways. Most seniors gamble for entertainment, but some older adults are gambling to cope with their negative emotions due to some life experiences that they're facing. And unresolved losses or a mismanagement of life stressors is the most significant risk factor or predictor of late life problem gambling. And we want to make sure that we're watching for those warning signs of problem gambling, including gambling alone, going without food, medication, spending increased times and money, gambling. And then that first step in preventing problem gambling and reducing that risk to older adults, whether in our lives or in the populations that we work with, is to really become more educated about the issue. It's also important to remember that education, whether to ourselves or to our communities, education alone is not going to prevent the problem or help those who are struggling. What's going to help prevent the problem and those who are struggling is if we promote that sense among older adults, that just that overall sense of general well-being and a supported network, and also understanding those risks that are associated with gambling. But that support network is vital to people who are coping with that grief and loss. And because grief and loss and mismanaged emotion or mismanaged stressors is really that number one predictor of late life problem gambling, we want to make sure that we're doing everything we can to help those folks cope. So thank you everybody for tuning in today. I hope you've all gained some insight into the possible risks associated with gambling for the aging population. If you have any questions about what was covered in today's session or anything additional, don't hesitate to reach out to me or Paul Noonan at OASAS. And I want to thank everybody again for your time.
Okay. Well, on behalf of OASAS, Jamie, I'd like to say thank you to you.
Thank you
for doing this for us. You're always a welcome addition to this program, and I think I said at the very top that I expected great things, and Jamie certainly delivered. So thank you, everyone, for tuning in and watching this, and please take advantage of our Learning Thursdays mailbox if you have any questions. Thank you once again.
So I'd like to kind of join the line of thank yous, and as always, thank our presenters for being here with us. Today again, Paul and Jamie, they have been here a number of times, so I really appreciate their volunteering to help enhance the knowledge, skills, and attitudes of our field. For those of you viewing this, if you ever have any questions, feel free to send them to the mailbox, which is located on the slide in front of you. As I've talked about in the past, we appreciate your feedback. If you would like to afford us some feedback, feel free to direct yourself to the link noted on your slide, and I believe it's 10 questions, and we do look at that as a way of assessing that we're meeting your needs and a way of assessing how effective, how productive you think the presentations are, how relevant they are to your job as well. So if you'd like to take that time, we would appreciate it. I always want to thank Media Services. They do all the behind-the-scenes work that offers you the professional product that you receive when you open up your new Learning Thursdays every other week or every other month, or every month, excuse me. So Media Services, thank you for that. And I do want to, I train and I go out in the field an awful lot, and I meet a lot of really good, dedicated professionals out there. And so I've decided that when the opportunity presents itself, I would like to either give a shout out to some of those people or kind of dedicate a Learning Thursdays to them. So for this Learning Thursdays, I would like to dedicate it to Fitzy in the downstate area. She knows who she is, and she is a wonderful student of learning in our field. She's very open to learning, very cognizant of learning, the importance of knowing what you need to do in the field. So Fitzy, this is for you, and thank you for joining us as well. All of you, thank you for joining us. This is Patty, and I will see you again. Bye now.